Hi, my name is Mandy Nye. I'm the Director of Nursing Operations, and I'm here to present a proposal for the development of a nursing resource team and the consolidation of per diem nursing positions into full-time nursing equivalents. After conducting a SWOT analysis, there was an apparent opportunity to better manage fluctuations in nursing demands that are related to increased census. The organization's mission is working as one to improve health through exceptional care for all, lifelong wellness, and healthy communities. Nursing staff are challenged with limited numbers of staff available when census surges or patients require one-to-one care. Per diem staff are not flexible. They're not available when urgent needs arise, which increases overtime and incentive costs. And it also places a burden on our full-time nurses to work long hours and to pick up that overtime, and places our patients at risk for errors. When this happens, the mission statement to improve health through exceptional patient care and places our patients at risk and places our mission at risk. Addressing staffing issues better positions the organization to provide safe and reliable patient care, reduces staff burnout, turnover, and errors. It builds trusting patient relationships that improve staff and patient satisfaction. My proposal to reduce overtime and incentive hours by adding full-time positions and consolidating per diem positions is to create a nursing resource team over the next 12 months. The new full-time positions will be added based on historical data, converting hours paid in overtime and incentive to full-time equivalents. The proposal will use the manage by objectives strategy, leveraging goal setting, action plans, progressive review, and overall performances met by these goals. The background work performed was collecting the average daily census, the frequent daily census, and the staff required by each nursing unit. The use of intermittent leaves of absences, family medical leaves of absence, unscheduled paid time off, leave of absence due to paid time off balances being exhausted, they were all calculated into these factors. Additionally, the number of per diem staff positions maintained and the hours that they worked, the number of hours of mandatory education that they required for competencies was assessed in comparison to the cost of consolidating these positions into full-time equivalents. The information was shared with the nurse managers for feedback regarding the consolidation of the positions into full-time equivalents, and their questions and concerns have been addressed, and they have assisted the directors in setting goals and developing action plans to benefit all nursing units. This decentralized approach has fostered an investment from the nurse managers and collaboration to ensure the successful implementation of the nursing resource team. The proposal will use a staggered approach, allowing managers to transfer per diem positions as they vacate to the nursing resource team for consolidation into the full-time equivalents. And it will also allow us to assess our additional needs for full-time equivalents that we'll be presenting to our operations team at a later date. The nursing resource team manager will consolidate the full-time equivalents, recruit staff to create a schedule for around-the-clock coverage available to assist all the nursing units. The staff will float to various areas, reducing the burden on our full-time nurses and nursing assistants in patient care areas. And it will reduce their burnout due to working overtime and incentive shifts to cover these vacancies. The strategy impacts financial performance, it impacts customer service, and our learning and development. The reduction of overtime and incentive, as well as paid for performance initiatives, will be that would be lost or at risk of being lost, will improve our overall financial performance. Nurse managers and directors will track the success of this plan by assessing monthly financial reports on overtime, incentive, and productivity. Customer service will improve when nurses are able to address patients' concerns promptly, when nurses are able to take time to collaborate and educate patients on their health and the next steps. It builds a trusting relationship that supports the patient's continued use of our healthcare system. The nurse managers and directors will track overall patient satisfaction scores to assess that we're meeting this goal. Learning development is impacted with our nursing school relationships, our shadowing and intern programs, and our tuition reimbursement. This is a pipeline for nurses who are awaiting positions, and it's critical to satisfying our needs for our increased nursing demands. The recruitment and retention of highly skilled staff and ongoing education will be tracked monthly by managers and directors through turnover and retention rates. Additional metrics that will be tracked will be the intermittent leave of absence, which will be reduced by providing a healthier workforce, and leaves of absence related to paid time off benefits being exhausted, and the usage of unscheduled PTO will be reduced as well. The approval of this plan strengthens the organization's commitment to its mission by ensuring patients' health is improved through exceptional care for all. My goal would be for this group to approve the addition of a nursing resource team and the per diem staff being converted into full-time equivalents with a request at a later date for full-time equivalents that will be needed to further complement this nursing resource team and provide the 24/7 coverage that each nursing unit needs to maintain the demands of our increasing patient population and our nursing shortage. So my goal hopefully will be for you to accept this proposal, and we'll be able to track our metrics and ensure that we're meeting our goals. Thank you.